Before we get to Ask It Early with our Dr. Jennifer Ashton, I just want to let you know that I think that the weather's wreaking havoc on our signal, so we're having trouble getting in touch with Stephen Wiltshire, the artist down in Brooklyn, but we're going to certainly try and bring you that later in the program. But now we want to turn to Dr. Ashton, who's back to answer your medical questions. Good morning.
Good morning, Maggie.
This is such a popular segment. We get more questions than we can use, so let's get right to the first one. We have Gary from New Jersey on his webcam, and he has a question for you. Gary, good morning. Go ahead.
Hey, good morning. Acid reflux prescription drugs are really, really expensive, and I was wondering if the over-the-counter drugs are as effective because they're much less expensive.
Gary, that's such a good question. They are really expensive, especially the ones like Nexium that are called the proton pump inhibitors, or PPIs. But a couple of really important things about reflux. First of all, affects 1 in 5 Americans, so you're not alone. This is heartburn, and it can be potentially serious because it can cause damage actually to the esophagus. So if you're having just mild symptoms that occur occasionally, yes, over-the-counter medications like Pepcid are usually fine. Of course, you should always check with just your regular primary care doctor. If you have persistent or severe symptoms, especially that don't respond to the over-the-counter medications, then it's probably not a bad idea to see a GI specialist who can really then kind of take it to the next level in terms of treatment. But you're right, they are really expensive.
Great, thank you.
And if there's like a generic version of Pepcid, is that okay too?
Well, Pepcid is the over-the-counter one, but something like Nexium, they oftentimes don't come generic, so they are really expensive, and you don't want to make a big drug choice without checking with your doctor. If they want you on those expensive ones, you should probably stay on them.
Here's a good question. A lot of people have been asking this for months and months and months, and this is a perfect time to put it on television. This one is from our Twitter page. Mauricio Jordan was wondering this: if the H1N1 hysteria has been blown out of proportion because many people die from the common flu every year.
That's right. Mauricio knows his facts, which is about 36,000 Americans die every year from seasonal flu. To put another context or perspective to it, 45,000 Americans die every year in car accidents. Now, in medicine, we always have to plan for a worst-case scenario and hope for the best. We won't know if we've blown H1N1 pandemic out of proportion until maybe this time next year. But for the 1,000 Americans who's had a death in their family due to swine flu or H1N1, they probably don't think it's been blown out of proportion. So it's all about the perspective you have.
All right, let's get another viewer question in on Skype. From Minnesota is Becky. Good morning, Becky. Go ahead.
Good morning. Hi, Dr. Ashton.
Hi, Becky.
My question is, I have been a vegetarian for 18 years. I am now 3.5 months pregnant and concerned about protein intake. I know it's very important, and I'm wondering if I can be a successful vegetarian and have a healthy baby, and what I need to be watching for.
I want to say that Dr. Ashton is an OBGYN, Becky, so you're asking the perfect doctor the perfect question.
That's right, and
Excellent.
Congratulations, Becky. So first of all, yes, absolutely, you can continue to be a vegetarian and grow a perfectly healthy baby. You need about 60 grams of protein intake a day, and of course, you probably know you can get that from things like peanut butter and tofu and whole grains. You don't have to eat animal protein, but again, you do want to be careful, and also as a vegetarian, you can have deficiencies in B12 and zinc, so that's where the prenatal vitamin is really important. Congratulations.
Congratulations.
Thank you.
How is, I know your wife, Nicole's pregnant. How is she coming along, Jeff?
She's coming along great, only 3 weeks away.
She's on the launching pad.
Yes,
that goose is cooked.
the launching pad. No, but she's been very conscious of what she's been eating as well. She didn't have any weird cravings, actually, throughout the whole thing. Really,
you did, though,
little
right?
bit of a sweet tooth. Yeah, I've been freaking out the whole time, obviously. She's like calm, cool, and collected. But I cannot wait.
3 weeks.
Neither can we.
It's a boy, right?
It's a boy.
You're still not going to tell us the name.
I'm not.
Congratulations.
Yeah.
Just from the Department of, this kind of comes in, ask it early, but damned if you do and damned if you don't. You heard yesterday from the White House that the Obama children have been vaccinated for H1N1, right? They're clearly trying to send a message that it's probably a good idea to get your kids vaccinated, and then there's the whole backlash of, well, wait a minute.
Well, you know an important point, Harry? First of all, we don't know their confidential medical history, the girls. But the other thing is, don't forget that children can be vectors or spread the virus to adults. We obviously don't want the girls to get sick, but we certainly don't want the president to get sick.
But they
either.
said, the parent, that both Michelle and President Obama are going to wait because they're not in the
high risk.
Exactly right.
But they're taking care of their high-risk daughters.
There you have it. All right.
Thank you, Doctor. If you have any questions for our Dr. Ashton, just log on to cbsnews.com. You could also link to her Twitter page.